Hello to Healthcare Hour with Colleen Qvist. As you know, I'm Colleen. Apologies up front for the voice, guys. I did 4 days of workshops, so don't know where the voice has gone. My guest has kindly agreed to talk more than me today, so you won't be hearing this weird little voice squeaking at you. Just to remind you about Healthcare Hour, that it's all about healthcare professionals. It's about us knowing that healthcare professionals are people. It's also about us improving the relationship between the healthcare professional and the patient, and for us as public to be educated, for us to be informed as to what's happening out there and to take ownership of our own health. Today's show has got a trigger warning on it because it's about suicide. And so after the break, we're going to meet Michel'le Donelly, who's no stranger to the show. We've met her lots of times. But let's go for the break. And when we come back, we're going to hear all about what she has to share with us today.
How do you know the life or personal coach you're about to work with is who they say they are? How do you know if they can do the job? At the Africa Board for Coaching, Consulting and Coaching Psychology, we can tell you. So, before you share your secrets and spend your money, check with us first. Visit www.abccccp.com or call us on 012-751-7608. The ABCCP, the professional body for coaches.
Welcome back. You're listening to Healthcare Hour with Colleen Qvist. Sorry, guys, no voice. I suppose we should have got a new voice to do this. But anyway, hi, Michel'le. Thank you for joining us.
Hi, Colleen. I'm so sorry about your voice, but great to be here. Thank you.
I suppose it's the reality of, yes, it makes you realize you've got to look after the voice. All right, so Michel'le, today's show's got a trigger warning on. We're going to be talking about suicide, specifically about the World Suicide Prevention Day and changing the narrative.
Yeah, thanks.
So let's hear from you about the stats about suicide.
Sure. So yeah, World Suicide Prevention Day, commemorated every year on the 10th of September. And it's just so important that we do commemorate this day because despite ongoing efforts to raise awareness, suicide rates are going up each year. Suicide is a global issue. It's one that affects every person from all countries, all different contexts. And it's also the third leading cause of death amongst 15 to 29-year-olds. Globally, suicide accounts for more than one in every 100 deaths. And then for each death, there are 20 suicide attempts. And if we look at our partners at the South African Anxiety and Depression Group, or SADAG, as they're better known, they operate our country's national suicide hotlines. And they report that 1 in every 4 calls that they're receiving is suicide related. And so in South Africa, we also have very high rates of suicide. It's estimated that every day 23 people are losing their lives to suicide. And we do have the third highest suicide rate out of all African countries. And our male suicide rates are also particularly very high. So it's something that we do need to be talking about more, and we need to be normalizing it. And I think that's why the hashtag or the theme of changing the narrative is so important.
Yes. So World Suicide Prevention Day, what day is it on? Is it the same day every year?
Yeah, every day, same on the 10th of September. And you find that a lot more organizations are also starting to commemorate the month. So September will become, Suicide Awareness Month. And it's very easy to remember because it's the 10th of September and World Mental Health Day is the 10th of October. So both of them are on the 10th.
Okay, so 10th across the board. All right, so what I'm hearing from the stats is that there's a lot of suicide ideation.
There is, next to just, if we look at completed suicides and people are dying by suicide, I think it's also very just important to remember that behind that, there are those suicidal ideations and there are those suicide attempts as well.
Yes. Okay, so in terms of changing the narrative, how does that work? What do we need to do?
Sure, thank you. So it's such a great, I think, theme from the International Body for World Suicide Prevention. They're the ones who set up the theme, and they usually last about 3 years each time. So the previous theme was creating hope through action, and this theme is now, changing the narrative. And I think it's really about looking at how do we inspire individuals, communities, organizations, as well as governments to really start engaging in open conversations, having honest discussions about suicide, about suicidal behavior. And the idea is that, if we have these conversations, we can start to really break down barriers between people. We can break down that stigma. Having the conversation, talking openly about suicide also raises awareness. People need to understand what's happening. People need to understand that people are losing their lives to suicide, something that's so preventable. And if we start talking about it more, we'll also maybe create better cultures of understanding amongst people, because again, a lot of people don't understand suicide. There's always a lot of stigmatizing language around it. People describe people who do have suicidal ideation or who do die by suicide as, being weak, not being strong enough. Some people, if you look religiously, it goes against, it's, very taboo around in religious circles. So we want to have these open conversations. We want to talk about it so cultures have a better understanding. But we also want to have the conversation so that we are able to help people to get the support that they need. And really, when we're talking about changing the narrative, it's about sharing people's stories, real stories, sharing the conversations people had with themselves when they were experiencing suicide. Last year, we were so fortunate to have a young person by the name of Lerato Solomon. She shared her story about her experiences with suicide and how she came through on the other side. And so things like that are so important when it comes to looking at how we change the narrative.
Yes. So what I'm also seeing is that people sharing their experience of it coming out of the shadows. I was also seeing as well online as well, where you were seeing when I was 16, I didn't want to make it to 25. I'm 30 now. Some of it was me wanting to be alive for the release of the second book in a trilogy I was reading. Some of it was wanting a tattoo. Some of it was the McSpicy announcement. I've been kept alive by small, dumb things. And so you're also seeing as well, it's like where someone shared, like, oh, okay, not today because of. And so it's those little moments where people are saying, okay, no, not today.
Yeah, no, definitely. And that's such a beautiful story. And I think, when you hear people who have lived experience, sharing their experience, it just creates so much more impact rather than, people who are advocates working in the space saying, don't die by suicide, reach out for support. Someone who might be dealing with suicidal ideation, that wouldn't break through to them because they're like, you don't understand what I'm going through. You don't know what it's like. But, when you actually hear people who are experiencing suicidal ideation, who are coming out and saying, look, that was me a couple of years ago, but this is what I've done. I think that's so much more impactful. And again, it creates the safety to have the conversation. And it's just, I think over the years, we've seen suicide becoming more and more prominent in conversations. And we even see it just being mentioning it more in mental health policy as well, because I think, again, suicide used to be a taboo. People don't want to talk about it. You hear people saying that if you talk about suicide, you're giving people ideas to then, die by suicide. And it's like, that's not the case at all. It's a very real thing that people experience. And we need to be talking about it because we want people to have hope and we want people to get the support that they need.
Yeah, and so it's almost like it's not that if we speak about it that we like suddenly making the topic cool or wow, trendy, or that kind of stuff. Let's get in the news.
Exactly. Talking about it doesn't give people the idea to then die by suicide. I know a lot of people, and we do talk about, especially in media reporting, you don't have to mention the way someone might have died by suicide because there is, some people believe that gives other people ideas of how to do it, but there shouldn't be a need to shy away from it. And I think a lot of people appreciate when they do hear news stories of, celebrities or prominent people who might die by suicide, because I think it gives them a lot of pause to think like, wow, if, someone who I believed has it all, this could happen to them. Perhaps because I'm having these thoughts, I should reach out for support.
Yes.
And so it's very important that we have these discussions.
Yeah. And so to that point also, Michel'le, we've spoken about, die by suicide. And I'm sure a lot of people listening to us are saying, no, but like, where on earth are they coming up with that phrase from? So can you explain the background to that?
Sure. Thanks, Colleen. Yeah, I think, again, as time has progressed, I think our mental health terminology has definitely improved. Terminology across the mental health spectrum has gotten better, and it's because of stigma, right? We don't want to stigmatize people who have mental health conditions, and we don't want to stigmatize people who do die by suicide. And so we know that the popular term is, committing suicide. And the thing with that is it kind of criminalizes the person who has ended their life by suicide, and it really isn't something that they committed, that, it's not a crime that happened. We usually talk about committed in the sense of a criminal activity that's taken place. And so usually, if someone has died by diabetes or, died of another condition, we talk about that. We don't say someone committed that. And so that's why we try and change the language around suicide. So we would prefer people to say, and just be mindful, instead of saying, so-and-so committed suicide or they are suicidal, thinking about using language that is died by suicide. People have suicidal ideation. And it really is just about destigmatizing the space. And again, making it a safe space to have the conversation around suicide.
And what I'm also seeing about that as well is, sometimes you don't hear how the person died. And it's also like, oh, hush, hush, we can't talk about it. And then people also, oh, it was suicide then, and then make a point of finding out what and how, as opposed to just saying the person died by suicide.
Mm-hmm. Exactly. I think it's still, a lot of people still maybe don't understand it, and that's why we do need to talk more about what can lead to suicide. 70% of people who die by suicide do have a mental health condition, and usually the mental health condition mostly associated with suicide is depression. But there are people who die by suicide who haven't been diagnosed with a mental health condition, and it's just because people can sometimes find themselves in that state of complete hopelessness, complete isolation. They feel that they have no other options. And that's where we want to meet people. We want people to know that they're not alone, that there is support, and that they just need to reach out.
Yes. Okay, so Michel'le, let's go for a break. When we come back, we're going to be talking more about our topic of how to change the narrative about suicide. We'll be back.
The home of inspiration every day.
Most people give up on themselves easily. The human spirit is powerful.
From news,
countries across the globe have been hit by the COVID-19 virus.
Views.
There's a global trend to see an increase in GBV incidences, specifically domestic violence.
Sports.
What's he say? It's a really good ball. It's Shabalala.
And music to inspire you every day. This is Vuka Online, your inspiration radio station.
Welcome back. You're listening to Healthcare Hour with Colleen Qvist. I should maybe get Michel'le to do this, but my voice has gone. Yes, so sorry that you're hearing this strange little squeak, but the show must go on, as they say. And yes, so you are listening to Michel'le Donelly, who is from the South African, here we go, South African Federation for Mental Health. And she's been talking to us about suicide. So we said that there is a trigger warning on the show, but also how do we change the narrative? How do we change the story that we're telling about suicide? So what else can people do, Michel'le?
Yeah, I think from our side, we just want people to really start having open conversations. We want people to understand that, as much as we want government policy to be better, and we do commend the government, when we look at our most recent national strategic policy framework on mental health, suicide prevention is mentioned. There is an actual action plan dedicated to suicide prevention, which is great to see. The thing is that outside of policies, it's up to us as communities and individuals to actually have the conversations, to extend that kindness to someone, and to meaningfully ask someone like, hey, are you okay? And also being open and honest ourselves when we're not okay. Because the truth is, the only way to have these honest conversations is for us to be vulnerable as well. So we need to look at ourselves. We need to think, hey, how can I be a kindness to someone today? How can I be the person that maybe help someone through something today and provide that support? Because I think one thing that we can all agree is that we are living through some really challenging times. And everyone is going through something. There's no one person who just has everything sorted and is like living their best life. And so if we approach our lives with that idea, share kindness, show people that we genuinely want to know if they're okay, and also share when we're not okay, we're able to create a space where we're having these open conversations, and hopefully people who are struggling with their mental health, or people who are having suicidal ideation, then feel safe enough to reach out and say, hey, I'm not okay. Can we talk, or can we get a coffee? Maybe they reach out to our National Suicide Crisis Line as well. Something that we're very big on, especially every World Suicide Prevention Day, is letting people know we do have a national crisis line, which is really great to see. It is run by SADAG, our partners, the South African and Depression and Anxiety Group. And it is, it's a toll-free line. Counseling is available in all official languages, and it operates 24 hours a day. So we want people to reach out to our National Suicide Crisis Line if they are struggling. And the number for that is 0800 567 567. So that's really the aim.
So what you're saying as well is like, in a day of hopelessness, you can be that one little spark of hope for somebody.
100%. We all have days where we feel really, really low. And I think we can all put ourselves in someone else's shoes who maybe are feeling completely low, who feel completely knocked down. And we just need to think about the fact that, people are struggling, and asking, are you okay? I think it does simply boil down to us as human beings at the end of the day, connecting with one another, taking a few seconds out of our day to check in with a colleague, with a friend. If you know someone might be struggling as well, definitely then reaching out and just asking, are you okay? And remembering that small gesture of kindness could be enough to save someone's life as well. And so that's really what we want to do. I think what's great so for this year as an organization, we've chosen to spotlight a music video that was put together by a young, he calls himself like a social artist. So, he creates music and art that really has a message. And he's from Spain, but he's fallen in love with Cape Town, and, really works with the small community in Cape Town. And one of the things he wanted to do was put together a music video focused on creating a positive message for suicide, really talking about how people need to be expressing themselves. And in the music video, you have young people really dancing, bringing that to life. But, one of his motivations, he said, was he just couldn't believe that, these amazing people in his life who he could see as lights didn't see that within themselves. And that was across his friends in Spain as well as in South Africa. And, he's also lost people to suicide. And so for him, it was really about, how do I get this message across that, you are worth it, you are a light, and you need to express yourself, and I'm here for you. We are here for you. And so, it's a really great little music video. It's on our website if people want to check it out. Again, there is a trigger warning on it as well, because it does talk to suicide, but it's just a great initiative, I think. And again, another great example of how suicide is coming into the narrative, and that you can have a positive spin on it, rather than, a message out there that kind of just gives you a story of suicide, but doesn't leave you with any kind of hope.
Yes. Yeah, so this young man's name is Javi. I think that's how you pronounce it. And I
Yes.
see Jumbo Nampula, so obviously he's got his South African name too.
Yeah,
Yes,
exactly.
Rodriguez. And he was saying that he wrote the song because he got tired of meeting amazing young people who told him that they tried to die by suicide.
Exactly that. Yeah.
Yes.
No, it was great. And it was so lovely. Like Javi or Jumbo, he reached out to us and he's like, look, I've put this music video together. It's really to raise awareness for suicide. Would it be something that you'd be interested in using or sharing on your platforms? Because he really just feels that it's something that should be out there, and hopefully it gives people that hope that they need and that encouragement to know that they're not alone, and that it's okay to express yourself.
Yes. Okay, Michel'le, let's go for another break. Let me go look for my voice again. Let's go for a break.
The Africa Center for Work-Based Learning is a professional development center for professionals who aim to improve their professional standing. This means that the learning programs we run are more than just academic programs. They are work-based programs that focus on leveraging your current experience as a professional to build your overall profile. A year down the line, the Africa Center for Work-Based Learning is developing into a preferred center for professional development in Pretoria, with 8 professional development faculties including accounting, teaching, entrepreneurship, as well as IT and many more. For more information, go to acwbl.org or dial +27 12 751 7608. The Africa Center for Work-Based Learning, where work is learning.
Welcome back. You're listening to Healthcare Hour with Colleen Qvist. My guest today is Michel'le Donelly. She's from the South African Federation for Mental Health. If you're wondering where my voice has gone, AWOL. But anyway, the show's got to go on. We've been talking about changing the narrative around suicide, especially seeing as 10th of September was World Suicide Prevention Day. It's international, and it's also about us changing the narrative, changing the story. So, Michel'le, if you look at somebody who's feeling hopeless, who's feeling like suicide is an option, and they're not able to talk about it because of the stigma around suicide, it's almost like it's closing doors for them.
Definitely. I think stigma is still such a big thing that we see in our communities, and we understand that people feel it 100%, and that's across the board. So just talking about mental health in general can be stigmatizing. And so obviously people who are then struggling with suicide, it's even feels more stigmatizing because, in some countries, we're so lucky that in our country it is decriminalized, but there are countries who are still fighting to decriminalize suicide because it's seen as a criminal offense. And so, when you're thinking about these things, you're thinking about the taboo in religious circles. It can be very difficult for people to share. And again, there's those thoughts of, oh, if someone knows that I'm thinking about this, then they're going to label me as, crazy, or they're going to see me as weak, and they're going to see me as less than. And so that's really why we want to change the narrative and really speak to more positive things and say it's not about the stigma. And we need to change people's ideas and mindsets about how they view suicide, and really speak to the fact that, everyone struggles. We are living in challenging times, uncertain times. We all know what it's like to feel so low. And we all know what it's like to just feel like we want one person to be kind to us this day. And that's exactly how we should approach people who might be struggling with suicidal ideation. It's the exact same thing. They're struggling, and they're really struggling to see the other side of things. And so we do encourage people who are struggling to reach out. If you can't speak to someone in your life, then reach out to the suicide crisis line. It's anonymous. You can speak to a counselor, and they can share, what you can do to really start taking care of yourself. But also, I think you mentioned earlier someone reading from their journey, or writing from their journey, and saying it was about choosing one thing every day that they wanted to live for. And that can really help. It's really about us thinking about, what are the things that bring us hope? What are the things that bring us joy, that make us feel fulfilled? And if that's something that can keep you going, that's great. And then if you are someone who has struggled and you've come out on the other side and it's something that will be with you forever and you feel like you want to help, sharing your story is helping. Sharing your story is advocacy. And so that's really what we want to encourage.
Yes. I was reading one story as well where somebody was saying, no, they had to stay around because, Taylor Swift's redoing her albums. And they were saying, no, we got to stay for the next album. Yes.
That's great. Yeah. And exactly whatever brings people joy, that's what they have to do. And I think it's, when it comes to suicide, one of the other things to talk to communities about, and just the general public, maybe you're not struggling with suicidal ideation, but you are struggling with your mental health. It's really important that you take care of your mental health. It's really important that we start putting in those protective factors, thinking about our mental health the same way we think about our physical health. Are we doing daily activities that help our mental health? Are we practicing mindfulness or stillness, having times of meditation or prayer, whatever that looks like to you? Are you practicing self-care, right? Self-care is very important when it comes to understanding mental health and our own mental health. It's about doing activities that are good for you, that are fulfilling for you. And it looks different for everyone. And it's so important that you know what helps you to take yourself from that dip in your mental health into good mental health, because we all have mental health. We all need to be taking care of it.
Yes.
Yeah, on
We
that
just
spectrum.
got to be aware about where we are on it. Yes.
Exactly.
Yeah, and also it's also so important as well is that we know in terms of heart health, for instance, that connection is so important for heart health. And also about, your whole mental wellness, that whole, the more lonely you are, the more you're going to struggle with your mental health.
100%. Social isolation and just isolation in itself is such a big thing. I think we saw it exasperated by the pandemic. A lot of people found themselves having to be in lockdown by themselves, and that's really where I think more conversation started around feeling lonely, feeling isolated, and really talking about why we need to start connecting more. Connection is very important, whether that's connecting with your family and your friends or in the community. Does it look like volunteering? Does it look like signing up to a community run? But really, connection is so important, and it just helps us to feel like we're not alone.
Yeah. And I think also it gives you purpose outside of yourself.
100%. It's so interesting that we talk about different things based on research that people can do for their mental health. And, it's walking in nature, exercise, but one of them is volunteering. Being kind to others is research and scientifically proven to help our mental health. It gives us that boost of serotonin. And again, it's about connecting and, like you said, giving yourself that sense of purpose.
Yes. And so what you give out comes back.
100%. What you give out comes back. And I think as long as we understand that we're all human, that we don't stigmatize people, that we don't think, oh, I would never do that, I would never go through something like that. That's how we then create a society where we're all kind to each other, a safe society for us to talk about all kinds of issues, including suicide.
Yes. So, Michel'le, thank you so much for coming to encourage us to change the narrative on suicide. Could you give us the contact details again?
Yes, so our National Suicide Crisis line that operates 24/7 is 0800 567 567. And then if people are, maybe they're not struggling with suicide, but they feel that, actually I need some help, but I'm not sure what service to reach out to. I'm not sure what's close in my area. They can also reach out to our help desk at SAFMH. We have a help desk that is dedicated to assisting mental health care users and their families, but also general members of the public to understand more information about mental health services. And we act as a referral partner as well. So we're able to then refer refer people. So you can reach out to our help desk at info@safmh.org, or you can call us on 011-781-1852. We also have a WhatsApp line, and it's 076-078-8722. Yeah.
Thank you so much for that. Thank you for being an awesome guest once again.
Thank you.
And I'm sure next time my voice will be back.
Fingers crossed.
All right. So thank you for joining me. You've been listening to Healthcare Hour with Colleen Qvist. As I said, next time the voice will be back. In the interim, please remember that you're loved, you matter, and you're definitely not alone. We'll see you next time.
Thanks.
Bye.